I've been working at this job for 40 years, as you can tell by the color of my hair. And I would say for the first 30 years or so, we didn't see a lot of movement of the needle in ways to improve outcomes for patients. But in the last 10 to 15 years, I think the breakthroughs we've seen in cancer immunotherapy have really revolutionized where this whole field is going. I'm John Bell. I'm a senior scientist at the Cancer Center in Ottawa. I work on the development of biotherapeutics for the treatment of cancer. We sort of inadvertently discovered that viruses could preferentially infect and kill cancer cells and not normal cells. And this was really something we hadn't appreciated before. We can use genetic engineering to really create biological machines that can attack the cancer very selectively and maintain a memory within the patient so that cancer can't come back. And every day when I come to work, to my labs on the third floor, I pass through the waiting room and I see the people who are battling every day with this disease and sort of their bravery and the things they do. I think if I was to say there's one person in particular who I've always been inspired by, it would be Terry Fox for sure. When I think about what he did to advance the cancer cause and the whole Fox family, an inspiration to say that one person can make a difference. And if we all work together, we can make a difference. And that's sort of been how I felt about my whole career. So I have to say, aside from my lovely wife, Sheila, that Terry Fox has certainly been an inspiration to me. In fact, we named our first son Terry in honor of him. I applied for a major grant about 7 years ago to form a network across the country of researchers and clinicians working together to work towards trying to solve the cancer problem. And it's brought me great colleagues from British Columbia again, Brad Nelson in Victoria, Rob Holt, Kevin Hay in Vancouver. And we've been working together with other colleagues here in Ottawa to develop a new novel immune cell-based therapy in Canada. And we're now seeing patients walk out of the clinic who are doing very, very well. When I look back at previous winners, this is really a collection of the elite of Canadian scientists and international scientists. So to be recognized in this group is really an honor and very flattering to us. As we move forward, as we understand even more about cancer, ways to manipulate people's immune systems so they can fight their own disease, it's essentially a form of personalized therapy that they create for themselves. And I think that's the way to actually end up curing people and keeping them from suffering from the treatments, because these are very selective and very specific kinds of therapeutics. Very optimistic that in the next 10 years or so, we're going to see dramatically different outcomes for patients.